this next segment, we will be talking about how coronavirus is transmitted. We will be defining infectious and incubation periods of the disease. And lastly, we will just be talking about prominent symptoms of COVID-19 and as well as who is at risk for getting the disease. When a person that is infected with COVID-19 coughs, sneezes, or talks, they actually release droplets of saliva or mucus into the air. And these droplets that are in the air can put other people around them at risk for being exposed to the virus. And virus transmission is very easy. All it takes is for someone to either inhale these droplets or even touch a surface with the virus on it to become infected. So let's say, for example, Kofi has COVID-19 and he coughs or he sneezes. His friend Amma, who might be around him, can inhale these droplets from his cough or sneeze and then be exposed to the virus. Another example is, let's say Ya, he has COVID-19, he coughs, sneezes, and then release droplets onto a surface. If Kwaku touches the surface, he can then become exposed to the virus. Scientists have found that the virus can actually stay on a surface for up to 3 days. They also found that it can stay in the air for up to 3 hours. So it is very important that we are aware of this and we protect ourselves and stay informed. The coronavirus does usually show up as mild flu-like symptoms for most people, but in some cases it can be very, very severe and even leading to death. So it is very important that we protect ourselves. Some people are more at risk for contracting the coronavirus than other people. These people include the elderly, such as people who are over the age of 65, people with any underlying health conditions such as heart disease, lung disease, a compromised immune system, or asthma. And I also just want to mention that children are not at an increased risk for the disease. However, we should continue to keep them safe and protected. So keep these vulnerable groups in mind as you are protecting yourself and preventing the transmission of COVID-19. It's truly these people that we are just trying to protect and care for the most. Be discussing exactly how a person becomes infected with COVID-19. So those airborne droplets that we talked about can either be inhaled or picked up from a surface, and once they get picked up, a person may proceed to touch their eyes, nose, or mouth, and that's how the virus enters the body. As soon as the virus enters the body, it travels to the back of your throat, and that's usually when a cough or a sore throat develops. Then it travels down to your lungs, causing inflammation that could lead to really bad breathing problems. A person can experience things such as shortness of breath, high fever, cough, or they can be asymptomatic, which basically means that they never develop any symptoms of the illness. This can be a little bit scary because a person can be infected with the coronavirus and not show any symptoms for up to 2 weeks. This is called the incubation period. So the incubation period is basically the time span from when the person gets the disease to when they start showing symptoms of the disease. And during this incubation period, they can still actually spread the virus, even when they are pre-symptomatic. Pre-symptomatic means that it's before any of the symptoms have started to develop. So as alarming as this sounds, it is really important to know that even if a person doesn't actually show any signs or symptoms of having the coronavirus, they could still very well be infected and still spread the virus to other people. So just keep this in mind, okay? Okay, so next we'll just be going over some common symptoms of the coronavirus disease. Some of them are coughing, shortness of breath, fever, chills or shivering, muscle pain, sore throat, new loss of taste and smell. And some severe symptoms include kidney failure, respiratory problems, or even death.